Hey friend, welcome to Grounded, the vestibular podcast. I'm Dr. Madison Oak, aka the Vertigo Doctor. I am the vestibular physical therapist who is here to help you with all things dizziness, imbalance, and vertigo. In this podcast, we explore the fascinating world of vestibular disorders. Come with me as we dive headfirst into a journey to discover the mysteries of the brain, the inner ear, and the balance mechanisms that keep us grounded. Whether you've been managing dizziness for one day or 25 years, we're going to get real about what it takes to manage dizziness, handle the anxiety cycle, and thrive, not just survive, with your vestibular disorder. First, I want to remind you that this is never medical advice. Remember, this podcast is for informational purposes only and may not be the best fit for you and your personal situation. It shall not be construed as medical advice. The information and education provided here is not intended or implied to supplement or replace professional medical treatment, advice, and or diagnosis. Always check with your own physician, medical professionals, and healthcare team before trying or implementing any information found here. This week's win of the week is by Michelle. She says, I was able to venture out to the garden center and actually got a little garden planted. I did have to use a walking stick on the gravel because boy, that threw my balance off, but no dizzy. I love this so much because she's like, I did a new thing. It was scary. I had to use different tactics and strategies, which is what this is all about. People do not like when I say that, but it is the truth. This is what it is all about. But I didn't get dizzy. And that is the thing that truly everyone is trying to avoid, is getting dizzy. So I absolutely love this win. Congratulations, Michelle. This did not happen overnight, just like everything, right, you guys? Everyone wants this to cure, boom, be gone tomorrow or next week or whatever. All of these things take time. All of these things are going to be true if you can be consistent with your progress and all the things, and even fight through setbacks that are going to happen and predict that they're going to happen. But I absolutely love this because, yes, she's like, yep, I needed to use a tactic, but I didn't get dizzy, and I planted a garden and went to the garden center. So congratulations to Michelle. Absolutely love this one. All right, let's get into the episode. Let's talk about how to get the most out of your doctor's appointment with quick tips. I have way more tips about this in the longer version in vestibular group fit, of course. But most people get something wrong about the doctor. Your doctor, and what I mean by your doctor, I mean, a lot of us are doctors. Like, I'm technically a doctor, but when I'm saying this, your physician, your medical doctor, your DO, your medical provider, is not meant for a lot of the things that we try to use them for. You have to go in there remembering you get 10, maybe if you're very lucky, 15 or 20 minutes with this provider once every 3 to 6 months, maybe even once every 12 months. That is very frustrating, and I completely understand that, and I wish we could change the healthcare system. However, because I do not have the power to change the entire system of healthcare in which our world revolves, I want to teach you how to navigate it more easily, because going in there and trying to treat your medical doctor like your therapist is a very bad idea. And I know that a lot of people are like, I'm just trying to get them to understand how difficult this is for me, how much it has changed my life, how isolating it's been, how much anxiety it is provoking, all of things. I hear you and I get it, but it is the wrong way to go about going to the doctor. So, quick tips. First of all, do not treat them like your therapist, period, ever. Exclamation point, full stop. Do not treat them like your therapist. What they want to know is what medications and supplements you are currently on, what you have tried, what you've not yet tried and or want to try. Very specific questions that you might want answers to, and a broad overview of things in bullet point format. Bring your binder full of previous history stuff, imaging, blood work, etc., that you might need or maybe have done at a different provider's office that they don't have in their EMR system, electronic medical record EMR system, or even if they have. Some of my doctors still use handwritten documents, which is a whole other issue. And then you can also bring another person. You do not want to go and bring them an entire document with every attack and symptom you have ever had. You do not want to bring them not being sure what brings you in today or telling them every single thing that has ever happened. That is a really bad way to go about going to the doctor. The best way to do this, and if you've done this before, it's okay. Most people do it, but at your next appointment, to get the most out of it, this is what you want to do. Your doctor will say, "Hi, what brings you in today?" Or maybe they have seen you before. What are the updates? What are the updates since you've seen them last? Or what are you there for? I feel dizzy. I have list maybe 5 symptoms. It gets worse when, it gets better when. I have tried XYZ. I've been referred to you because, and then they will have questions for you. The doctor's job is to diagnose you with a diagnosis, hopefully, in under 10 to 20 minutes, which, if you know the amount of information, and gaslighting is not okay, telling you this is just anxiety is not okay, but the amount of information and the way that doctors' brains work, a lot of my friends are medical doctors, is they have been taught about very specific symptoms that go in specific boxes, and it's their job to very quickly pull the information from those boxes in their brains and tell you, okay, I think you might have this Meniere's disease, vestibular migraine, neuritis, or send you for testing to confirm, send you for imaging to confirm, or refer you to someone else and or prescribe you medications for that thing. That is their job. If you are going to the doctor and expecting them to give you lifestyle changes and dietary changes and teach you how to exercise and tell you how to do VRT and also run 100,000 blood work things, it's not that they don't necessarily want to. It's that a lot of this literally is not in their education. Like exercise prescription, not in medical school. That is what PT is for. Dietary stuff, sure, they are taught some nutrition, but not enough. That is what a dietitian is for. They go to school for a very long time to do one very intentional and very specific thing. And what they were likely taught about dizziness and vestibular disorders is that BPPV exists. A lot of dizziness is related to anxiety, and that they can tell you that it's either anxiety and you maybe need to de-stress, or that's BPPV and you need an Epley maneuver, or I don't know and you need another provider. Now, that is in defense of doctors. I understand that this is often not how it goes and that there is gaslighting involved and a lot of other frustrating things. I know it's in my DMs. It is happens to my patients. I know. But understanding what the medical doctor is for and knowing that they are not there to give you every lifestyle change that I provide in vestibular group fit. They're not there to teach you how to exercise again. They're not there to, frankly, usually even comfort you in the fact that this is isolating and this is frustrating. So this is like a very blunt talk, and I do hear my tone right now, but most of the time you need to, and I know it's hard because insurance and all the things, you need to talk to your doctor just about the things that your doctor has questions about for you specifically. So go in there with like a 3 to 5, probably 3 minute maximum thing that you want to say. And then they're going to have questions for you. And then you might have more questions for them. Write it down, bring bullet points, literally read from your script so you don't get overwhelmed, and bring someone else with you. Those are my quick tips for the doctor. Now, one other thing that I want to say, it's about insurance. Insurance is like a diatribe. Is that the right word? A diatribe that I could go on for literal, actual hours about why it does not work. And I think you probably know by now that it doesn't work. But a lot of times it feels scary to start to go out of network and find different providers that aren't like at your hospital system. But a lot of times it actually ends up costing you less money. And I want to explain to you why. Because the other day, I got a question in group, something along the lines of, my family doesn't really understand why I'm using vestibular group fit instead of going through like the approved list of insured providers. And the answer to this is very vast and long, and I won't go into like the entire thing. But the short answer is that A, vestibular disorders are not taught in med school. So if you want to bridge the gap between what my doctor knows and what I need to tell my doctor, you're going to need to find probably someone who does understand what's going on. I understand what's going on, trust me, who can give you that information and kind of coach you through what doctor you need to see next. A lot of times that doctor is out of network, which again feels scary because you know up front that seeing that doctor is probably going to cost you $300, $800, $1,200, whatever it is. However, seeing an in-network doctor a lot of times also ends up costing you that much money, but you don't always think about it because it's been 6 months and then this doctor's bill arrives and you're like, oh my God, why do I have a $650 bill that I didn't know was coming in the mail? And this is because you have to hit your deductible before insurance starts to pay for stuff. And even when you hit your deductible, most people have co-insurance, which makes it so you are still paying X amount of said visit for a lot of people because in reality, insurance doesn't actually work. And we basically just want to use it for catastrophic events for most of the time, not for everyone, but a lot of the time. So yes, if you can find a doctor who is in your network, who can work with you and all of that, that is fantastic. But a lot of times it's actually going to be less expensive. And we have research to support this. Like specifically for physical therapy, that you will have fewer required visits. You will see less providers. You will need to do fewer unnecessary tests. So, like a lot of times with insurance, you are required to go to get an MRI and try these 6 other alternative drugs, which step therapy is like a whole other issue. But you have to do these 17 other things that you don't necessarily need, but insurance requires you to do before you can actually get said treatment. And then also, if you go to something like physical therapy, and I'm like, we need to do education and practice lifting your head up to look up in a cabinet. And they're like, okay, but that's not medically necessary because you don't actually need to look up into the cabinet. You could put your stuff on the island. They will then deny that claim and you will owe me money as a physical therapist. Not me money, but your physical therapy clinic money because they deny it. So, all of this to say is that quick tip for the doctor is a lot of times it's going to be cheaper to go out of network the first time. And the second thing is that you want to be as short and sweet as humanly possible in order to properly get diagnosis and treatment from your provider. I hope this makes sense. If you have questions about this, I know I'm not the best at explaining insurance, but you can ask ChatGPT how this works because they will tell you the same thing. Um, but if you have questions about this, please let me know. But at the end of the day, the reason vestibular group fit works so well for people is because they're like, hey, I'm having trouble with X, Y, and Z, and I can provide you the exact references that you need to fix X, Y, and Z problem, whether it is looking up and down or driving in a car or not knowing which med to try next. I can't tell you, you should try. You should only request Nurtec, but I can say, here are 6 drugs that are common options. You can talk about which one is the best for you between you and your doctor because your doctor may not have even heard of this new medication or whatever, because that is my job, is to stay up to date on these things. So at the end of the day, group is going to help you bridge that gap. We have scholarship programs, as always. We have HSA and FSA approval for most people, especially if you get a letter of medical necessity. And if you have any more questions, comments, or concerns, please shoot me a DM at the Vertigo Doctor. You know where to find me, hopefully, and I'm happy to help. Okay, love you. Bye.